So thank you everyone for joining us on and welcome on our today's Alive Learning Forum session. Um, okay, we're sharing the screen. Yes, so as you can see on the screen on today's session, we are going to have a presentation on what can living evidence learn from parallel fields, lessons from implementation science. And we have a wonderful speaker today, Dr. Robyn Mildon, and we're going to have that for 20 minutes. Following that, we would have a moderated discussion and a Q&A session for 30 minutes. And I really encourage everyone to bring on your thoughts, your ideas, your experiences, and questions you have. We can speak on it. And also, if you want to put them in the Q&A on the chat box, then I'll make sure to read it on behalf of you. Then we will finish the session by next steps. Yes, so for those of you, next slide, please. So for those of you who are joining the Alive Learning Forum for the first time, the Alive Learning Forum is a platform for a global exchange for advancing living evidence through collective learning. And this is a platform where evidence leaders come and share their innovations, their experience, strategies around strengthening living evidence partnerships. And just for clarity, when we're talking about living evidence, we are indicating to evidence that is continuously identified, synthesized, and updated to keep pace with the rapidly evolving knowledge and decisions. Next slide, please. Okay, so it gives me really great pleasure to be one of the co-chairs for Live Learning Forum. So my name is Firmae. I am a public health professional. I work on evidence-informed decision making and the interface between evidence and action. And I work on this in Ethiopia in the Africa region in collaboration with national, regional, and international organizations. I currently serve as a researcher at the Ethiopian Public Health Institute, and I'm a co-founder of the Center for Evidence Synthesis, Support and Development in Africa. And I'm a board member of the Pan-African Collective for Evidence. Next slide, please. So next slide. So just to, so to help us make the session a success, a few housekeeping. So please keep your microphones off until you're invited to unmute. And the session, as raised by Ruth in the chat, is going to be recorded and also it will be shared online publicly. So for those of you or for people who have not been able to join, they can find it online. And by joining this session and also registering, you have been added to our mailing list for future events. You can unsubscribe at any time if you would like. I hope that's not going to happen. But and if you have any queries on this specific session and also other forums, please you can contact the coordinator at aliveevidence.org. Next slide. And for those of you who might feel comfortable with the translation, we have Wordly. You can find it on the top right corner of your screen. You can click the link and you can choose your preferred language for translation, and you can look at the translation and also follow the meeting. Okay, so now coming into today's session, which is going to be on what can living evidence learn from parallel fields, lessons from implementation science. So with this session, we are hoping to increase understanding of implementation science concepts, to explore barriers, facilitators to implementing evidence, and also explore implementation science and living evidence integration, and hopefully strengthen connections within the evidence use community. So to help us with this, next slide, we have the amazing speaker, Dr. Robyn Mildon, who is an internationally recognized leader in research translation, implementation science, and policy and program evaluation. She is the founding CEO of the Center for Evidence and Implementation, a global social purpose organization working across 18 countries. And her work has significantly advanced the use of evidence in policy and practice, strengthening outcomes across health, education, and human services. And in 2022, she received the prestigious John Westbrook Award for Continuous Knowledge Translation from the Campbell Collaboration. So this is just the tip of the iceberg. But as we go into the discussion, I really encourage, again, everyone to bring on your thoughts, your ideas, and if you have any questions, we can discuss on it after the presentation, or you can put it in the chat box. Over to you, Doctor.
Well, thank you. Thank you very much for inviting me to speak at your learning forum. And also thank you for those of you that are obsessed with work enough to show up in a early December talk at probably likely an odd time zone for you. So appreciate that. And I promise I will stick to the 20 minutes. I have got quite a bit of content, so I thought what I would do is do a crash course in implementation science and why it can really help living evidence reviews. So I will do what implementation science says I shouldn't do and talk at you for 20 minutes. And then hopefully you have some questions or we can have a little bit of a discussion. And again, appreciate for you logging on and those that will watch it later in the recording. So next slide. So I am based and coming to you right now from Melbourne, Australia. And one of the things that we do in Australia is acknowledge the traditional owners of the land that we're coming to you from. And where my 2 feet are planted right now is the land of the Wurundjeri people of the Kulin Nation. And it is important that I pay respects to them and elders past, present, and emerging, and acknowledge it always was and always will be Aboriginal land. And we have a long way to go actually in Australia into fixing past and current harms. And so I just want to acknowledge and pay my respects to the original custodians of the country that I am lucky enough to live on. Next slide. So just a tiny bit about Centre for Evidence Implementation. So we are a global not-for-profit for-purpose group. And we do a bunch of things, but they're all about trying to accelerate the use of evidence in policy, practice, and funding decisions. Mainly out of a couple of worries that those of us in evidence synthesis and implementation and use in implementation land have, and all of you would have around the slow, if sometimes very poor uptake of evidence into policy practice and funding decisions, but also the very sometimes inappropriate at times use of evidence, not paying attention to the context in which it needs to be, especially at a global setting, in which it needs to be used and implemented. So we do a bunch of things to try and do that. Next slide. So I'm going to, again, this is the fastest introduction to implementation science one could want. Why does implementation commonly fail, which most people really resonate with, and then how can implementation science support and strengthen living evidence reviews? Next slide, please. So again, why focus on implementation science and how it can help? Next slide. So this hopefully resonates with everybody that is watching this or has had some interest in implementation. The very basic fact that research translation, knowledge translation, the science of research use, implementation science, they're all terms that are sort of meaning the same thing, and you'll see a slide from me on that later. But regardless, humans cannot benefit from something we don't get. And that is where implementation science came from, is this concern of we have this great knowledge and research and data, and we're just not breaking through to getting it to people who could benefit from it. And so it doesn't really matter how much research and how many synthesis we do, and unfortunately how many trials we do. If people can't benefit from that, then we aren't making progress. Next slide. And I've just got a few examples. So the work CI does, we work across an enormous amount of areas. So child protection, child welfare, education, mental health, public health, health itself. So you'll see me peppering a few examples. But this Aaron Lyon and Eric Burns, this quote's getting a little bit old, but I like it a lot. So for decades, research have focused on what works to address student mental health concerns, for example, which has resulted in an array of evidence-based practices to be delivered in education. However, the methods for ensuring the effective use and implementation of these have been much slower to develop. And often the use and implementation part is the part people think is easy. And then if we just produce the evidence, then I call it magic fairy dust. The magic fairy dust will instantly help it get implemented. And we know that not to be a fact. Next slide. And this is a very well-known quote a lot of us use and reference a lot of us use in implementation science. I do need to update this. There was a recent study done throughout Europe, the UK, and the US that said we're not at 17 years now. We're probably more at 14. But the point is, implementation science, the study of the how to get evidence effectively implemented and sustained, came out of a concern about how long it was taking us to take something that we know can really support and improve the lives of people into usual business. And if you think in an early childhood context, and those of you that heard me speak before, this is quite common. If we're still at, say, 15 years, and we know how important the first 5 years of life are for the development of a child's growing brain and executive functioning and all that great stuff that we can give them, that's 3 generations of kids missing out on something they could benefit from now. And so that's really where a lot of the research and studies started to bore out of, given all this good evidence and science we have, how are we bridging that gap, if you like. Next slide, please. And so the science of implementation is simply the study of how research findings and data, so you can go beyond kind of traditional research studies, and evidence-based procedures, sometimes people call it evidence-informed procedures, are best adopted and integrated into day-to-day practice in the routine way in which people get things. And implementation practice simply involves applying that research in practice. So in the work that we do at CEI, we not only do implementation research to study how to close that gap and overcome that, but we also take that research and we apply it in practice in teams that we deploy to work with people on the ground to help them better use some science in the area that they're working in and build that into what they're doing and make it far more sustainable than it's been. Next slide. And I'm hoping you can't hear the dinging behind me, but it's 7 o'clock at night in this house, and I have a lot of young adults that live with me, and there's something going on there, which I'm hoping you can't hear, so apologies. So this is just a little bit of word bingo, or word, not bingo, that's the wrong. I think sometimes one of the criticisms of behavioral and implementation science is we come up with a lot of terms that tend to mean the same thing, which make it quite difficult, particularly for evidence synthesis people, to synthesize what's working and figure out what advice to provide. So this is from Trish Greenhalgh. She's a fantastic implementation scientist based up in the UK. We just find this a little bit helpful. So some people talk about the diffusion of evidence. So the passive and unplanned, unintegrated spread of information. We sort of refer to that as sort of letting it happen, which is a little bit like this forum. So I'm spreading information as far as I can and sort of hoping that I help let things happen to improve implementation. If you take the next step along, there's dissemination, in which this is more targeted. You might do some particular training for a particular population or a particular group that has a specific need. So it's far more targeted, but it's still involving materials and particular interaction with the audience. So that's dissemination. When implementation scientists are talking about implementation, we're talking about making it happen. So we're talking about the deliberate use of strategies to improve the adoption and integration of evidence into a practice or policy setting that is sustainable. So it is a very, some people refer to it as sort of technical assistance, sort of dialed up, but it isn't necessarily a passive or straight dissemination activity. And most of the research would sit very, very clearly. And if we really want to bridge that gap and sort of go after decreasing inequality, which is a big area in implementation science, then we have to turn our head to making it happen in partnership with groups on the ground trying to do the work. Next slide, please. And, this really matters. So this is just one example in mental health. We have, and this reference is getting a little bit old now. It was 2014. It's falling off the slide there. The 2020 is where this original reference has come from. So Williams and Renard Bidas. They went and looked at all the research that they could find on interventions to address mental health and alcohol and drug problems in young people. And they found over 500, and I'm using air quotes for those that don't have their camera on or only listening to this, so air quotes with my fingers, evidence-based interventions that they could identify in the literature. And I will call out, a lot of them had very common practices or ingredients in them, which is a whole other webinar we should do one day around what makes up these programs and how we probably need to think more flexibly about the use of evidence in a more flexible way. But regardless, what they also found that despite having over 500 identified interventions, most things that were being delivered in mental health were at low intensity. They were what the clinician preferred to do based on their training and had limited research support. And if you think again about youth and young people's mental health, there is some really good evidence about what we can do to help improve those outcomes for young people, which needs to be adapted for context, culture, and place, of course. And we need to get much better at that. But that's an enormous amount of research evidence that we're not using. And it would sort of play to the a thing a lot of us call about research waste. So when we're developing, you'll see later on the slides, when we're developing these kind of synthesis of research about what works, we've really got to be thinking about implementation and scaling from the start, because a lot of what is synthesized and produced is very difficult for people to implement on the ground or even understand what it is that they're implementing. Next slide. So why does implementation fail? Next slide, please. This, I hope, this isn't at all, shouldn't be I hope it's not a surprise to anyone, so I apologize if I'm just repeating back to you things that you know. But one of the things we find in the work we do around when people bring Centre for Evidence and Implementation in to do some work alongside evidence reviews or evidence syntheses or trying to implement different innovations, we often have to go right back to the beginning because it can be unclear what people are trying to achieve with the innovation itself. And that's so common. Often the stakeholders that need to be implementing it, including citizens, are not 100% sure what changes need to happen to achieve the result that the research sort of promised we could achieve. And unfortunately, the evidence that is backing the decision to implement this innovation isn't clear. And so the work of implementation starts right back to looking at the innovation itself that you're trying to implement and making sure it's very clear what people are trying to achieve, what changes need to happen, and what's the level of evidence to support it. And again, you'll see some slides later on sort of arguing for living evidence to help us be better at that. Next slide, please. I feel bad that, and then my, and sorry, this is a little slow. And people that have seen me speak before have heard me say this 1,000 times. One thing that well, there's many things implementation scientists need to get better at. One of them is we love a framework, and we also love a framework that have unhelpful names. And I know the authors of this framework, so I can get away with that and not upset them too much. So this framework I just show because one of the other reasons why implementation doesn't fails is a lack of understanding of the context in which you're trying to implement your innovation in. And so this is a great paper from 2013, David Chambers and team. And they did name this the dynamic sustainability framework. I don't know why. So I call it the three eggs because I find it much easier to come at. And the three eggs are trying to represent that whatever you're trying to implement based on what the evidence says needs to find the fit in the context in which you're implementing. And those arrows should go both ways. So this is in a health context, this example, where you have an intervention, an innovation, a program, a clinical practice, could be a policy that has components to it. It has practitioners that or people that need to do things. It has outcomes it's trying to achieve. That needs to find its fit with the setting in which it's going to be implemented in, school, healthcare setting, community health, a community itself. That also needs to find its fit within the broader system in which it's going to be implemented. And a lot of the work of achieving good implementation is finding the fit between the setting in which it's going to be implemented and the broader system. Because no matter what, practices and systems fail innovations every time, no matter how good that innovation is. So a lot of the work we tend to do sits in the blue and the dark blue, I suppose it is, area, and some adaptation of the intervention itself. So again, arrows going both ways to maximize the fit of the innovation. Next slide, please. And this is, again, very obvious, but a very serious point and needs to be resourced and funded properly, not including the people who will be affected by what you're doing in the planning is an utter barrier to implementation. But the amount of projects we do, so CEI works in 25 countries globally now. And when I ask, what stakeholders have you, what people have you engaged in the early process or the whole implementation process? If that has been not done well, we know we are in for a little bit of a few issues with the implementation process itself. And it's beyond even what I have on the slide. People with an interest in the outcome of what the work you're doing, who's going to benefit and lose from the work, and who's already affected and involved in the project. And people often do sort of one-off or some consultation at the beginning of work. In implementation work, we never stop engaging and working in teams because it takes a team to implement well, and implementation is a team sport. So I can't underemphasize how important working with people alongside with equal voice it makes for more effective implementation. And then poor planning, we call that pay now or pay later. In a lot of the countries we work in, they're pretty good at the teams we work with are very good at sort of trying to do an exploration phase about what we should be implementing to improve the outcomes we want to achieve. So skip the planning process and then go straight to implementing. And they often think implementing is training. And we know that is ineffective by itself. And we know from an enormous amount of studies it's ineffective by itself. And that planning phase needs to be protected, even if you're at the same time having to do the realities of rolling something out and doing a planning phase at the same time. But there's enormous amount of studies and implementation science showing that you just can't skip that. Next slide. Um, and high quality implementation is really about being clear about your what, which is where the partnership with alive and living evidence reviews really matters, but also the how. How is it that we know to effectively implement the what do we need to do? And you'll see a call out to living evidence reviews to get really good at the how, because those of us that work in implementation practice need that. And then really understanding what's getting in the way and what's helping implement the innovation that you're trying to work on, and targeting implementation strategies to overcome the barriers you can and sort of amplify the facilitators to achieve positive outcomes. Next slide. That makes it look really tidy, and it's not, by the way. This is a terrible slide. I know you probably can't even read it. This is another implementation framework that has a name, and I'm very fond of the person that developed this, Laura Dam-Schroeder. She, for her master's, took every implementation framework that was looking at barriers and facilitators and slammed them all together into what she called the Consolidated Implementation Research Framework, otherwise known as CIFR. And I don't have time, nor do I want to take you through this in detail, but she's done an excellent job of identifying from the literature and best practice all the implementation barriers and facilitators that you may come up against when you're trying to move from evidence to policy practice. And it includes outer setting, so you can see values and beliefs of the people that you're supporting, policies that are in use, inner setting of the place that you're implementing. It includes the individuals that might be doing the implementation. It includes the implementation process itself and how well done that is, and also understanding the innovation and how well described it is. So CIFR can be a little bit overwhelming for people coming to implementation science for the first time. It's quite good for studies in studying the implementation process, but it can be good as a bit of a tool also to identify barriers and facilitators up front and try and put a plan to overcome them. Next slide. And pairing with implementation is, something like CIFR is thinking through what implementation strategies can you put in place to overcome the barriers and amplify the facilitators. And again, people love an acronym in English. ERIC, the Expert Recommendations for Implementing Change, is a huge piece of work that was led by Byron Powell, that is used globally. Where again, he tried to identify all the implementation strategies that have been studied or mentioned in the literature and identify all of them as a call out for particularly evidence synthesis partners to try to better describe not only the what of the innovation, but how it was implemented and tested. And you can see there's over 80 different implementation strategies that he has identified. And we often use, globally, a lot of people are using ERIC to try and code better what implementation strategies people are using. Some have been tested a lot, like training. Again, by itself, it's often very ineffective, but training is important, but it needs some training plus strategies. And other things haven't been tested as much, sharing data, etc. So Eric, if you're into it, is a big deep dive. Again, implementation science is an open source science, so a lot of this is available to be able to know about online. Next slide. And sorry, I'm watching the time because I'm not doing a very good job. Okay, this is where I'm super happy. And because I did some work here, because I was trying to think about, instructed by my very good facilitators yesterday, about how I can kind of bridge the gap between Alive and implementation science community. So I've just got about 5 slides sort of not arguing, because I think, but sort of trying to lay out how implementation science can support and strengthen living evidence reviews. Next slide. So first, and this is where you're going to see some very poor use of pictures from me, because again, in my briefing, I was asked not to use too much text. And then, of course, like a good recovering academic, I struggled with that. So sometimes there's some random pictures in here, and I apologize, but living evidence reviews, and again, I'd be really keen to have a conversation about this, but just in brief, keep the science current. Implementation science makes science usable, contextually grounded, and embedded in real world systems. And that's how they come together. Next slide. So one of the things that implementation science can bring to the sort of work that your community does is ensuring or helping to ensure evidence is useful, usable, not just up to date. And you can see there what implementation science pays a lot of attention to is contextual factors of where science is being implemented, even when like good living evidence reviews are doing, even when at the end user it's based on what they're interested in and what they're doing. That's just one piece of the pie, one piece of the apple, one piece of the flower, or the contextual factors can just run right over, no matter what end users want to do, it can run right over it. So implementation science kind of helps with that. It helps gain insights into what's going to get in the way and what's going to help up front, so you can plan better implementation plans and guide how to tailor evidence outputs, which I think the evidence synthesis community we interact with is already really good at that. So I think those first two dot points is where partnering with implementation scientists can really help. And then the other, I think, is getting better and better. Next slide, please. Improving prioritization of questions of living reviews. Again, I was questioning whether I put this slide up because I think your network is really accelerating how effective the community is at being good at prioritizing questions. But where implementation science can give another kind of lens is which evidence is most critical, which I think communities like the Live are really good at, but it's the pain points in the delivery system. So those of us that are in the delivery side of doing things can like instantly get in front of this is what's going to happen and this is how difficult, particularly at a local level. And we do a lot of work on scaling now. And we are sort of asking the review community to be thinking about scaling from the start of a review, because you can do a really good review, or you can also run a really good trial, test an innovation. But a lot of the work that we've been doing recently often shows that the thing wasn't scalable from the beginning. And that's okay, because you don't want to have to scale everything. But often people are wanting to scale something that works. But the way that the studies have been done up front or the reviews have been done doesn't sort of help understand the scaling part. So we'd sort of advocate for some thinking about that up front. Next slide, please. This is an awful. So I've given you the most complicated implementation framework as a tiny picture in the corner, and that's just to demonstrate that we have a number. But there are fantastic frameworks that implementation scientists have developed based on studying the process of implementation and what gets in the way and what matters. That can really help interpret some of the evidence and make the evidence more implementable, if you like. So down here is Greg Ahrens is the developer of this framework. It's one of the more complex ones. And I don't normally show it as the first time introducing people to implementation science, but I think this community can take it. And most frameworks have three or four stages, sometimes five: exploration, figuring out what the evidence says and what you're going to do, and what figures out what matters for the context. There's always that planning phase, that preparation phase. Then there's an early implementation phase where you're implementing your implementation plan, and then hopefully sustainment. And what Greg's done is done a really good job at identifying all the things that can help and hinder to get in the way. And you don't need to pay attention to all of these, and you only address what you can in the context that you have. But it does help sort of think through in any innovation from the start what is going to help us, bridge that gap from the start. Next slide. And sorry, the EPIS framework, the one I just showed then, that's been used in, I think it's, over hundreds of studies now, globally, to either study the process or help plan an implementation process. So but it is one of the more complicated ones. Continuous learning loops. It's everybody talks about doing this. In my experience, in the 25 countries that we work in, we don't do it well. So if living evidence review is the product, implementation science needs to turn it into a learning system. And so, structured reflection cycles, methods for integrating evidence, behavior change and feedback. I've heard a lot of people talk about plan, study, do, act. I think it's what we should all be doing and what business essentially does. But I think in health, human services, and education, we do have a hard time doing it. But implementation science kind of naturally tries to build that in, where we're sort of improving the evidence itself while we're implementing. Next slide, please. Adaptation for local context. I mean, there is no doubt that there has to be adaptation for local context if we're trying to implement things in a number of different settings. And even if we pretended, in my experience, that we didn't, we have to because people do anyway. And so implementation science has a lot of fantastic recent research around how to improve equity, how to understand the implementation requirements, scalability from the beginning, how to contextualize adaptations. There's a fantastic study that I use, a bit old now, where the developers were looking at people affected by trauma through all sorts of life circumstances. And the evidence was pretty clear about this particular intervention that could help them. However, they were trying to scale it in multiple countries, and there needed to be some adaptation for context. So what they invited was, and what they were able to do is, these are the ingredients of the innovation that need to be held steady to get the effect. But here's all the things that you could do from an adaptation point of view, and we want to know about that. And so some of it was like the type of practitioner that was implementing it, and it was so again, from a evidence synthesis point of view, uh, the better we get at identifying the ingredients of innovations that make them successful or make them not, the better it is from an implementation point of view for us to be successful in implementing it. Next slide. I only put this up because it has Robyn. My name is not spelt with an I, it's spelt with a Y, but I found this. And improving the quality of studies. So again, we are advocating for better reporting of implementation processes in studies and reviews, in really understanding measurement better, fidelity, quality, context, adaptation, uptake, cost. And we do a lot of work now globally using hybrid effectiveness of implementation study designs, just for a few reasons, which make it at the other side of the gate easier for us to understand how to implement and improve on it. And I'll keep going. And that's a thank you. So I think I got to my 20 minutes. No, I went over. I have failed the task. I am super sorry.
No worries at all. Thank you. Thank you. This was a very insightful presentation, really. We needed that. And you can see that from all the, claps and hearts that are coming from the participants as well. This
And
is a very
Bellamy
interesting
teach me
space.
how to use the online kind of I need a
Yeah, sure. So um, thank you for reflecting on, the very important issues of the integration between living evidence and also implementation science, and bringing the idea of making it happen, sustainability, and as well, scalability that is also highlighted in the comments and the chat box as well. Um, so before I go into, I have a couple of questions, of course, and we have, I think, one question from the chat box, and I will come to that. But before that, I would like to urge everyone to please complete a survey that would really help us to make this forum better and tailored to our audience. I think the survey would come into maybe on the chat with a link, or it would be displayed on here. And I would urge everyone to not leave before filling this out. It would just take a couple of minutes. I think it has come on your,
it's up on the screen. Yeah.
yes, okay. So
I don't
please
think
let's
I can
fill
fill
that
it
out.
out. I think that's the definition of bias because I'll be like, very relevant. Yes.
Sure. So you can fill this out um, while the session is ongoing, but please don't leave without filling those out. And saying this, I have one question for you, Robin, and then we will go into the question raised in the chat. So, on your talk, you have talked about the implementation science and how it enables continuous learning. And as you know, living evidence, and when we talk about the interface with that, it provides an updated evidence that really keeps on evolving. And what I am wondering about is what are the sort of the practical steps where organizations or teams can sort of take up to turn evidence updates that come from living evidence into really regular reflections and also adaptations and practical application in the different systems that they're working in based on your experience.
Thank you. Um, we have a vision that organizations and even communities will have implementation focused teams as regular as not all globally, as some groups have information technology teams, because it is a particular skill that can be taught. And you can, and there's not a lot of places to train in implementation science. So a lot of us came to it, particularly in the South, came to it out of, some pretty um, dramatic career failures of doing a lot of synthesis and nothing getting implemented and no change happening, particularly in the work that we do around the removal of kids because of child abuse. Um, the So it's sort of a hand in hand. I think traditionally what's happened is the synthesis people work over here, and I used to be part of the Campbell collaboration for a number of years. So we do evidence synthesis, and the implementation people work over here, and there's no integration of those two functions, or implementation isn't thought of from the beginning of any evidence review or any updates or any live updates or and so I think we need to be better at forming teams that have those skills. So our implementation teams at CEI have quite different skills and training to our synthesis teams. But when they work together, it's far more powerful. And also when they're working together with delivery units on the ground, it's far more powerful. So often when we start working with the group, and if we know the research or the synthesis team is here and the implementation team is here and they're not talking to each other and the data is kind of getting lost in the middle, that is an implementation barrier in and of itself, the structures that are set up. So overcoming some of those structures, um, schooling implementation teams and delivery units in how to better understand evidence and what it's worth and what it's not at times, because it just sometimes doesn't keep up with practice. That's the reality of it. And equal for those, synthesizing and using evidence to understand what it takes to deliver on the ground. So I think that would be a real game changer if we could integrate those things and sort of work better as teams. I think we could speed some things up. That would be my one ask.
Mhm. Sure, makes a lot of sense, sure. So thank you for that. And we have a couple of questions. I'm just going to read the first one from Akubaro. Sorry if I'm mispronouncing your name, but the question is, how different is evidence synthesis from knowledge translation? I can note from the discussion implementation science still has areas to improve, including a common framework. How can what is already done in implementation science be done in fragile contexts like South Sudan, Somalia, and others? So, what is your experience of starting the Center for Evidence and Implementation? So, I think there are a couple of questions in there, but yeah.
Evidence synthesis and knowledge translation are different. And I would sort of say that I think the concept of knowledge, and this is just words, I mean, words get in the way of us all doing work, which is why I put the terms up. Um, So I think sometimes some of our colleagues that talk about knowledge translation, they are talking about implementation in the way I'm talking about it, and sometimes they're not. They're talking about dissemination, so releasing reports, running some training, which from the implementation science literature would say is helpful but ineffective to get the result. So they are different. Although, the Canadians talk about knowledge translation, the Americans talk about implementation science, the our colleagues in Southeast Asia, where we work a lot in, they talk implementation science. Other groups, some African countries we work with talk knowledge mobilization. So again, it's just language kind of getting in the way of what we're trying to do, and that's okay. Um, but implementation science has a lot of areas to improve. I don't think we'll ever have a common framework because context really matters. We will have common things about frameworks, like they all have phases, they all have 4 to 5 phases, they all have implementation strategies built in, but we have 4 or 5 different frameworks we use depending on where we're working and what we're working with. But it really needs to resonate with the people on the ground you're working with to do the implementation. It's like any kind of pragmatic data movement. It needs to talk to them, it needs to make sense, it needs to be valuable to them. So I think the CI has been under a bit of, we've gone back and forth over the years thinking about should we have a CI implementation framework, and I have resisted it. And I may be wrong, just because there are so many frameworks out there that, again, we find 3 or 4 we work with, and when we use them with stakeholders to see which ones they like. And a lot of frameworks have been studied, and I don't know about coming out with one united one. So that would be, but we definitely don't need 120, which is what's happening in the literature right now. It's like way too many.
Mhm.
So luckily, in my career, I've never done my own implementation framework, and you will never see me do it. And when I used to do Twitter back in the day, I was known for kind of calling out no more implementation frameworks, please, people. Let's focus on getting things implemented and tested. So, and I think that creates behavioral scientists have done a little bit of better job than we have of making implementation science accessible. So that's a we're that's something that we need to get better at. Um, Fragile context, I need to say South Sudan, Somalia, we're not working in those countries. We're working in other sort of fragile contexts, but we also have colleagues working in that setting. To be totally honest, some of the best implementation work I've seen is in fragile contexts because in high income, well-resourced settings, I call it the pile on. They just add more stuff and it's not really getting to people. Where we work a bit with a couple of groups in India and Bangladesh, and it really sharpens your sense about what's the least amount we can do to get that implementation effect, to get those outcomes. And I often use that work that we do in settings that where equity isn't paid attention to as much. So I think we have some of the most rewarding work we've done has been with UNICEF and some of the implementation research they've tried to do. In some of the groups in India, we're doing some work with Gates India at the moment around implementation and scaling of evidence, which is intimidating, but we will learn a lot. And we will be able to bring that into high resource settings that I think can um, I don't know, don't aren't so aren't as accountable to really getting things like can kind of I don't know, I don't want to come across as a criticism, but they sort of add stuff rather than go, what do we just need to get done? And so that some of the best implementation research I've seen is from complicated low resource settings. Hard to sustain, particularly in the current environment, but we have a lot to learn from those settings.
Great, thank you. Thank you for that reflection, Robin. And I think it also opens up the door to a continuous discussion around knowledge translation, implementation science, maybe for another session as well, and really brings out the importance of context. So we have, I think, three questions, but one is related, so we have two questions. I would present them to you, and I would ask you to respond to them maybe 1 minute each. I'm mindful of time. So the first
Yeah,
question we have,
we have like 5 minutes
yes.
on the
So
clock.
from Samantha, what have you
Hello,
seen?
Samantha.
Hello.
Thanks.
Um, so she asked, what have you seen or do you consider to be likely barriers to using living evidence in that feedback loop in a learning health system?
Samantha, that's not a 1 minute answer. I mean, yeah, exactly. So put your camera, exactly. Well, you would
I
know. I
just
know.
I'm happy for you to not answer, Robyn. I messaged Feme going, that was probably not right. Just to pass on to the next question.
Oh,
I'm happy
But you
for
would know. I
us
mean,
to
I
be
think
like that.
it would be good in another event to hear from you because I think you would have a lot to. I mean, there's just so many. Um, it depends how the living evidence is, written. It depends how it's delivered. It depends. Is there enough implementation information in it to help people understand the how, not just the what? So often evidence reviews will focus a lot on the what, but the how would be if we could get better at that, that would be super helpful. And then context. So evidence reviews really paying attention to, especially when we're doing global evidence reviews and trying to summarize all this research, context just really, really matters. And so if there's a way that clever living evidence gang could get at context, that would make things fantastic for those of us on the implementation side. Or, maybe having some implementation people on the evidence review team from the start. I'm not sure, depending on what the outcome is, but there is a lot. We do struggle, and it does create a barrier for people seeing living evidence reviews as useful. So, and we're all in on Lebanon's, like we are all in. So, anything we can do together to kind of improve that, I think would be helpful.
great. Sorry, Samantha, I didn't see your text there, but a great, again, another opening for more discussion, I would say. So I think the sort of final question that we have is from Ruth. So if you were in charge, what would you require from the evidence synthesis community to make implementation more likely? Where we also have a related question from Andele asking, where does knowledge brokering end and where does implementation start? Which I think is really a question of all knowledge brokers.
Yeah, so Andile, I would say knowledge brokers are implementation people. There shouldn't be a beginning and end like a passing of the baton, like a relay race. It's just different levels. So if you look at the science around knowledge brokering, a lot of it's implementation strategy. So sometimes I'll refer to CI as knowledge brokers. It just depends who I'm trying to influence. So I don't see the difference. And so I think those things should be slammed together a little bit more, brought together, sorry. And I mean, from the evidence synthesis community, to make implementation more likely, I would just plead um, for getting in where you can. And you're only working with the studies that you can get. So again, we do evidence synthesis, and we're really looking forward to Alive and other groups doing that so we can focus on the implementation part, but really getting a good understanding of the how. So although an innovation might have worked in multiple countries and it's like, how did it work? What was done? And again, studies themselves are very poor at describing that. So we understand that. But that would be amazing. The other thing that would be amazing is this community starting to do reviews in the effectiveness of implementation. That is still being super slow. There are lots of implementation studies. I've written a paper about it. The publication rates going kind of up quite steeply. And we need to know more about what implementation strategies work or don't work. We need to know more about cost. We need to more sort of turning evidence synthesis community towards synthesizing implementation research would also be phenomenal, which is done to a point, but often not done very well. So I'll pause. I'll stop because my little I have a little alarm of my children's voices who are young people now going, stop it, stop speaking. What happened then?
Thank you. Thank you very much, Robyn. And thank you everyone for engaging. This has been really great and very insightful. And I hope we will
Oh,
be able to continue this
someone
over
needs to
and
tell me how to do
see.
this hand
Yes,
fucking
this is a
terrible.
testament
No, but I need to know
to
how to
how
do
great
it.
this was.
Oh, I'll get my
Um,
18-year-old to show me how to do it, which is embarrassing.
sure. Okay, so before and thank you for everyone for staying on. And before we leave, I have a couple of next steps for us to take, and I hope everyone was able to respond or complete the surveys. Um, so our next session is going to be on January 2026, New Year, which is going to be in a live learns session on how to set up a living evidence partnership, learning from, sorry, the HPV Living Evidence Partnership. So our speakers are going to be Fuman Lekola and Brita, which is going to be chaired by Daniela Garcia. And maybe for those of you who are not going to be able to join the session, it will be recorded and also shared publicly, as we've mentioned earlier. And we really, really want to thank everyone for the year that we've had and for keeping our learning forum ongoing. And I really encourage everyone to suggest future ideas for future sessions. And there's also a possibility for you to present your own ideas. Just communicate with us. And you could also engage by providing a guest blog, which would be featured on a live and by providing feedback. And I wish all of you a happy new year going forward. And please join us on the next session that we're going to have. And thank you again, Robyn. This has been really, really great. And thank you everyone for staying on and see you on our next session.
Okay, well, happy end of year for everybody. Get some
Thank
rest
you.
because we really need you synthesizing implementation research. If you could just get on with that, that would be amazing. All right,
Thank
thank
you,
you.
everyone. Bye
Bye.
bye. Have a good day. Have a good year. Bye bye.